Hi guys, myself Dr. Kumar Gaurav, and today we will be talking about the Boyle Davis mouth gag with a tongue blade. So as you can see, this is Davis mouth gag and this is Boyle's tongue blade. So Boyle Davis mouth gag was initially used for the inhalational anesthesia to keep the patient's mouth open. In 1910, Edward C. Saville published an exhaustive description of a mouth gag which he has designed. He admitted that it was a variant of the mouth gag designed earlier by the Hartman. So this mouth gag was noticed by the S. Griffith Davis. He mentioned it further to be used to perform tonsillectomy. And further, the Boyle, when he was in the US, impressed by the Davis gag and bought one. He modified it and christened it as a Boyle Davis mouth gag. We need to see here that its frame is open in C shape. The frame has a handle. This is the handle. A set of tongue depressors of varying sizes supplied along with this gag. The tongue blades slide into the slot provided for its handle, the mouth gag. The tongue blade will fill the space within the C-limb. The tongue blade will hold the tongue, thereby preventing. Now here you can see how this tongue blade is holding the tongue, thereby preventing it by falling into the surgeon's field. Now here you need to see there are two extensions known as the incisor prongs at the top of the frame, which will fit into the patient's upper teeth. These extensions are rubber lined and prevent the injury to the teeth. Since its invention and design, this gag has undergone close to 20 modifications by different surgeons. See, the size of the tongue blade varies from patient to patient. The rough size of the blade is chosen by kicking the blade across the patient's chin and the oral cavity. The length of the blade should not exceed this distance. The gag is usually held in position by the M stand, which is also known as the Bangren's plate, and Dreffin's bipod. Now here you can see these are the Dreffin's bipod. This is the M stand or the Magren's plate, and here is your Boyle Davis mouth gag, which is being held here. This is a surgical setup how the surgeon is performing tonsillectomy using the Magren's plate, Dreffin's bipod and Boyle Davis mouth gag. This is a complete surgical setup and how the patient is sitting. Now what are the advantages? The advantages are it is easy to apply, it is adjustable, it allows both the hand of the surgeons free to operate and can be stabilized using the M jack or the Dreffin's bipod. What are the uses? Basically it is used in tonsillectomy, adenoidectomy, palatal surgeries, pharyngeal surgeries like the uvulopalatopharyngoplasty and surgeries of the oral cavity. Well, the one disadvantage of this gag is that it cannot be used in tongue surgeries because of the presence of the tongue blade. Thank you guys. Do subscribe and share.